Welcome back to the Nonprofit Spotlight, a podcast where we try to name, elevate, and celebrate some of the amazing nonprofit organizations in our area and having a positive impact in our neighborhoods, where we try and sit down and have a great conversation with community leaders like one individual who's with us today, Neal Lawson. Today's episode brings us to a truth that can be easily missed. Even in places that look well-resourced from the outside, profound gaps in care still exist. Nowhere is that more evident than in maternal health. We're talking today with the leadership of Jennifer Bush-Lawson Foundation, an Arlington-based nonprofit born out of love, loss, and deep commitment to equity. The foundation is named for Jennifer Bush-Lawson, a woman whose own experience with high-quality prenatal care opened her eyes to a painful reality: that too many expectant mothers never get the care they need when they need it most. In Arlington County alone, 1 in 3 births has lacked first trimester prenatal care. That statistic challenges assumptions that it carries real consequences for moms, babies, and families long after delivery day. Over the past decade, the Jennifer Bush-Lawson Foundation has stepped into the gap through innovative programs like telemedicine, OB Connect, and remote monitoring. They've helped more than 3,000 families while dramatically reducing NICU admissions, C-sections, and emergency room visits. But their work doesn't stop at medical care. They also are making sure families go home with the basics like car seats, pack and plays, breastfeeding supplies, because healthy birth doesn't mean much if a baby isn't safe and healthy at home. This is a conversation about innovation, compassion, and the belief that where you live and what you earn should not determine whether you and your baby survive and thrive. I'd like to welcome to the podcast Neal Lawson, the founder and executive director. Neal, welcome to the podcast. How are you?
I'm doing very well. I really appreciate you having us on the podcast today and giving us the opportunity to share a little bit about what we're doing to help enlighten the community and make them more aware of some of the situations that you've described very appropriately. So thanks for having me.
Yeah, thank you for being here. So for a majority of our listeners, maybe this is the first time they've ever heard of the Jennifer Bush-Lawson Foundation. Can you take a moment and tell us about who Jennifer was, maybe her personal story, and how that continues to shape the direction of the organization today?
Sure. Happy for the opportunity. So Jennifer is my late wife. She was the love of my life, and we had just a beautiful sort of almost storybook marriage that ended in tragedy when she was unexpectedly killed in a tragic accident in Arlington County. But prior to that, we were blessed to have 3 beautiful children. And in her maternal journey, all 3 of her pregnancies were complex and difficult: gestational diabetes, hypertension, and every one of those, the children were premature and needed to spend time in the neonatal intensive care unit at Virginia Hospital Center. But thankfully, because of access to care and, to your point, the statistic of being seen in the first trimester, Jen was very diligent with her visits and her checkups, and her challenges were flagged early. They were addressed, and as scary as the NICU was, we had access to wonderful doctors and nurses, and all 3 children graduated from NICU and have gone on to have wonderful lives and are still thriving in the wake of those scary times. What really stood out to me for Jen was, and this is true with many mothers, maybe not unique to Jen, but her dedication to the children and her willingness to do whatever it took to make sure that they had the best chance at a healthy life was remarkable. And I'm sure all mothers share that sort of innate feeling, but part of it is having access to care. And so we became very aware of the access that we had and the fact that not everyone, even in Arlington County, shared that access. So that's actually something she and I discussed as parents and community members. And so I had a good, clear understanding of what her vision for impact might look like. And that served as sort of the spark for the foundation. In the wake of the tragedy of losing Jen, it was clear to me what we could do as a community to honor her dedication to her children and her dedication to equity, to access to that care that in some ways we took for granted until we had to use it. And even then, we never had to question whether or not we would get an appointment or see a doctor or have the care. We were scared and nervous, but we always knew that that was part of the equation for us. And sadly, that's just not the case for everybody. And so that was born into the mission of the Jennifer Bush-Lawson Foundation, which we launched after she passed. And our mission is to give mothers and babies a fair start at life. There's a lot that goes into it, but it's born out of Jen's passion for the kids and Jen's passion for everyone having that same access to care so they can have that same chance at a fair start at life.
Wow. That's beautiful. Thank you for sharing and telling us a little bit about her and her story. It's incredibly powerful. As you think about all the scope of work that you all do, maybe you could help our listeners understand a little bit about some of the realities that often go unseen when it comes to maternal health, and especially in that first trimester. What are some of the issues that come up, or some of the things that are most on your radar as a foundation?
Yeah. So I think what's really important in the first trimester is to start to build that relationship and confidence with your caregiver to know that they're there to help you. And it really gives you the opportunity to identify if there are any early issues. And the sooner that you can track, whether it's something with your blood pressure or fetal monitoring or whatever the case may be, or your blood results, as soon as you can identify any anomaly, then it can become part of the conversation that can have significant impacts downstream in the pregnancy and the birth process, and then postpartum as well. And so it's really important not just to have the care, but to start to have a relationship with your care team so that you know that someone's there to help you. And so it can lead to all sorts of downstream issues if you don't get that identified in the first instance. And it also it gives an opportunity to sort of understand where there might be gaps in each personal story as well. You know, some of the things that we do individually is because we know that maybe a mother to be doesn't have a car seat, or doesn't have a safe place for their child to sleep when they come home, or isn't sure how to deal with everything that comes after delivery. And you sort of say, oh, great, the baby's born, carry on. And lactation consultants is one of those things that people don't think about, and they all have downstream impacts. And so it's really trying to break down those barriers and get women access early on in the process so that they can get their care plan customized for their needs as early as possible.
Yeah. That's super important. Thank you. And in addition to that, you'd mentioned kind of in passing some of the long-term consequences that could be a byproduct of not having that relationship established early. Is there some of the things that your foundation has noticed that you're intentionally trying to prevent by bringing up that care relationship even sooner into the first trimester?
Yeah, I think it's simple things that I mentioned, having a safe place to sleep. One of the questions that you've got for me is what are some of the impactful stories? And I'm going to give one of those now. And this is something that the foundation experienced as we work with the women's outpatient clinic and the neonatal intensive care unit at the hospital, just to really understand these stories. What are the challenges for these women? And in one instance, there was actually a mother and her family. They didn't rent a room in a house. They rented a sofa for 8 hours a day and a drawer and a dresser. That was their living arrangement. They actually cycled through because that's all they could afford. And they teamed up with other families in similar situations. Their plan for the baby was to open up the drawer and let the baby sleep on top of clothing and padding in the dresser drawer as their crib. And so the safety issues that that come to mind with a scenario like that, that was an easy fix for us to say, great, well, let's make sure that we have pack and plays available for people who don't have a safe place for their baby to come home and sleep. And then from there, it's just what are the downstream impacts if you don't have a safe place to sleep or if you don't have a car seat? So in some instances, it's understanding what the downstream risks are and the stressors that come with not having those things. And some of that postpartum is well researched, and the impact of postpartum depression is well understood. But I think one of the places that we've also looked at is what are the social impacts for mothers and stress when they are pregnant and the baby is still in womb. And that is a place that is not as well understood. And are there developmental challenges that come from that downstream? Are there depression complications for the mother that come up downstream? These are all hypotheticals that we don't have the answers to today, but they're the kinds of things that we think are important to look into and to research so that as part of that first trimester, it's not just the medical care, but it's the emotional care and the wellness care, trying to make sure that stress and anxiety, I mean, having watched Jen go through the process, again, having amazing care, the stress and anxiety that comes naturally with being pregnant and giving birth is enough. And anything you can do to remove additional unnecessary stress and anxiety can only have a positive impact.
Yeah. Wow, thanks for sharing that story. And you're exactly right. So, what comes to mind for me is so, as the foundation and the work that you do, are you actually working regularly with some of those clients that you were just talking about and kind of hearing their stories and making those connections with caregivers? Or where do you step in terms of the care process?
So we don't get involved directly with the care process. We leave that to the professionals. We do partner with the women's outpatient clinic at VHC Health, as well as the hospital in general, and we meet with them regularly to identify voids. They're doing amazing work already, and our mission is, and supporting the work they're doing already. We want to try, as we're talking about breaking down barriers for women to have access to this care, we want to understand the reasons why there are barriers and where there are voids in care so that we can help facilitate, whether it's through funding or public awareness and seeking donations of pack and plays, and car seats and the like. And so we have a very healthy and active relationship and dialogue with the caregivers at the clinic and at the hospital, and we work with them to identify those voids. And that's one of the ways that the OB Connect program was born, coming out of COVID. Again, to your statistic of, and this is an important one, not having being seen in the first trimester can have a lot of challenges downstream. And these women really have to answer difficult questions. Am I going to step away from work? Am I going to have to take money for groceries and then go and get public transportation to go to the hospital and take time away? Am I going to lose my job? Am I going to have to put less food on the table? And so that was one of the voids we found, is like women aren't coming because they're having to answer these difficult, not because they don't want to be there, because it has other consequences if they don't, or if they take the time to do that. And the OB Connect program is a beautiful solution. Mothers, we've heard stories of mothers that just step into a utility closet at work for a 15-minute check-in, and they don't have to leave work. They don't have to pay for public transportation. They don't have to take time away for their job, but they can still have that care. And
Hmm.
so it's really engaging in that conversation with the caregivers to understand what the needs are. We don't do direct interviews with the mothers themselves. We have done some surveys in the past to sort of get sort of anecdotal information, if you will, but we have found that going through a process, engaging with the caregivers who are interacting with these women on a regular basis, is the best way for us to find out what the needs are in our community and how we can help fill the void.
Gotcha. Okay. So hypothetically, if there was somebody who's listening to this podcast that would need that service, whether it's the telemedicine or the OB Connect, or if there was somebody listening to this podcast who knew somebody who could take advantage of that resource, how would they find out more about that information, like more information about that resource?
Yeah, so in Arlington, if you happen to be in Arlington County, then the outpatient clinic at Virginia Hospital Center, it's not necessarily widely known, but if someone shows up, they will see you and they will treat you and care for you. So that is certainly a resource inside of Arlington. And we typically, if we have one-off requests, that is how we field them. Whether it's a local group who has created their own blankets and they want to donate these blankets to a worthy cause, or they have extra pack and plays or used car seats. We've also provided books. And so if you go to our website, the Jennifer Bush-Lawson Foundation.org, there you can see an email link where you can click on info at and send us an inquiry. And so we sometimes receive offers for donations or how can we help. And we have received some limited requests on needing someone who might need care. We're happy to field those, but we also want to make sure that those requests are going to people in need. And one of the reasons working with the hospital is nice because the outpatient clinic has criteria for who they serve. And so we know we've got constituents that are meeting sort of the criteria of the people that we do want to serve. And so we're always looking for how we can help. And so that is also a way that people can reach out to us and we can figure out the best way to support.
Fantastic. Speaking of being on the website and getting in contact with you all, if there are listeners out there that wanted to support your work, do you take donations by chance? I know you outfit, and you mentioned in passing car seats and pack and plays and things like that. Do you actively take donations, or do you direct those in other directions?
We do. We do. We have the capability exists on our website. Probably on every page, there's a little donate button, and does give the opportunity if anyone wants to make a financial donation to the foundation. We welcome that. We do most of our fundraising through an annual 5K and Carnival Day in Arlington, and we participate in another fundraising event. That's where we do the bulk of our fundraising. But we love and welcome those resources. It allows us to then increase the impact that we have with VHC Health and other partners. In fact, we held our 11th annual 5K and Carnival here in November. And as part of that event, we presented a $50,000 grant to VHC Health. And that grant is explicitly earmarked to hire an additional resource to expand the OB Connect program so that we can reach more mothers.
That's inspiring. Tell us a little bit more about the 5K. How does that happen? And do you need volunteers to help make that successful every year? Or is that something that you guys just do well and just encourage people to come out and participate?
All of the above. We always need volunteers. We do have a good dedicated group that seems to show up every year, and then always new people that come in as well. But the event has been, it probably will remain, the Saturday before Thanksgiving. That seems to be in a sweet spot of sports have calmed down a little bit. The jingle bells haven't happened. Turkey trot hasn't happened. So it's not a crowded weekend, if you will. And we put on a 5K that starts at the Knights of Columbus in Arlington and starts and finishes on their property. And if you're familiar with that property, it's just a beautiful campus. And then after the race, we have a carnival day. We have moon bounces, we have laser tag, we have rock climbing walls, petting zoos, balloon animals, a beer garden, mimosas, just a really fun day for the community to come out in honor of this mission and have a fun day for the kids, for the family, for the parents. And so we love to have runners. We love to have attendance for the carnival, volunteers, of course, and then we have sponsors that help support that event as well. And so it's a combination of awareness for the mission and vision of the foundation, fundraising, and then just a fun community day. And having done it for 11 years now, we've sort of gotten past it's a new foundation, friends and family of Jen show up to show their love and support, to now it's really seems to have established a foothold in the community as a community event that comes around every year, and new people coming in as some go off to school. And so it's been a real blessing for us. And it ties nicely to who Jen was. She was very active. She was a runner and loved to participate in the community and come together for a good cause. So it really is an embodiment of who Jen was as well, which is one of the things that I love so much.
Excellent. And that's just another way that the foundation, in all of its work that it does, also gives back to the local community and the neighborhood that you're doing that event in. So that's fantastic. Excellent. Maybe you could say a little bit about some of those partnerships and how valuable they can be, not only for the foundation, but for the community.
The partnerships with the hospital?
Yeah, or even the supporters that come out every year to raise awareness for the foundation's work.
Yeah, so we have sponsors, and then we have partners in the form of VHC Health that come out every year, and it's an opportunity to support the foundation and be active in spreading the message in the community. And so I think that as we have met those partners and interacted with them more, you start to hear the stories that even awareness of the impact on these economically vulnerable mothers, it starts to make you aware that even people who are maybe more affluent and have those resources and leverage them, there is still challenges and anxiety that's faced. And so it's just an awareness to the process for our community, not just to help those that don't have that access, but to have empathy and additional understanding for those that do. I could tell you, as a new father for our first baby who spent 5 days in the NICU. I mean, that was a terrifying process. And Jen had a C-section. So you've got a wife who needs medical care and attention and love and nurturing, and a child in the NICU. And it can be daunting for those that do have the resources. So I think it's understanding and empathy and all of that has helped sort of been the broader community impact. And for this community to learn that these services aren't enjoyed by all, even in our community. So when you think about Arlington, you think about access to care, you think about well-to-do, and these struggles about whether I go to the grocery store or pay for public transportation, take time away from work to go to the doctor, those are real in Arlington. And so I think that that's been part of the awareness and an enlightenment as well, that even in a community where on the surface, people think it's well-to-do and affluent, but there's a lot of diversity in Arlington County, a lot of diversity in Northern Virginia, a lot of diversity in general. And I think also having the perspective and really empathizing with everyone's journey, everyone's situation, even in a community where you feel like there isn't much need, there really is.
That's so true. Talking from other nonprofit leaders, people don't always see it, but it's definitely there. And the need is there. And organizations like you are vital to our community's health and well-being. So thinking about this and celebrating your 11th annual 5K and being able to do $50,000 of additional support to help the OB Connect program grow and offer more resources to mothers in need that can't be in person. Where do you see the foundation going in the next, say, year, 5 or 10 years? What are your hopes and dreams that it'll grow into?
Yeah, so I think continuing to do what we've done recently. When I started the foundation, I'm an entrepreneur and sort of brought that entrepreneur sort of feeling to the strategic planning of building the foundation. And I wanted to create a foundation and then expand it to the region and then create a roadmap so that others could duplicate it in other areas of the country. And I think over time, I've sort of settled into some of that same awareness. And yes, even in the early days, I knew there was need in Arlington, but it continues to exist. Even with the work that we've done and other nonprofits, there is a persistent and dynamic need that exists. And we want to try and push the envelope on innovation around how can we give that fair access to a fair start at life to mothers and babies. And what does that mean in 3 years? I have fun talking with VHC Health about some of my ideas as a creative thinker and an entrepreneur, and they're very good at grounding me back into the reality of what the real need is. And so it's evolving that relationship with the providers in the community and being comfortable to push them a little bit to step outside of their plan and say, can we ask additional questions? Can we look at ways to address these needs? And are there things that we can do not to solve, but to help make connections, bring awareness, and then facilitate what solutions might look like. I've always had, and if you talk to anyone at VHC Health Foundation, I like to bring up the idea of mobile care in the community. It ties back to something Jen did as a professional when she was alive, and it really emotionally had a strong tie for me. And I was like, oh, great. Well, if we can take these things out into the community, then we can break down some of those barriers and get access. There's a lot of logistics that come from that. There's a lot of moving parts and pieces. And of course, if you can bring care to someone's doorstep, then that's great for them in that moment. But does that scale? Is it efficient? And that's, as part of that conversation, is where we born the idea of OB Connect. And it started with high-risk pregnancies and has grown to a much broader reach for who it works with. But so I think it's continuing to understand what the needs of our community are. And that doesn't have to be just Arlington. That can be in the region, but not today thinking as sort of grandiose as previously to sort of go wide. No, I think go deep and really make sure we continue to focus on that mission here and in our community and make sure that impact is as significant as possible and that we're continuing to evolve, not just writing checks, but how can we expand the reach, expand the breadth, and really let that be what guides our conversations and partnerships with people like VHC Health.
That's great. I want to close our time with where we started our time and focusing on Jennifer and her story, and wanted to just give you the opportunity to reflect. And now that this is 10, 11 years down the road, what do you think Jennifer would be most proud of or most excited about if she could see it today?
Yeah, so she wasn't a name and lights kind of person. So, just the existence of the foundation and the mission, she would 100% align and her heart would be warmed from that. But it's really the expansion of the care and the impact in the community that she would be quietly very, very proud of. When she passed and I was reflecting on who she was and how that should weave into the DNA of the foundation, one of the things actually I shared in her eulogy was that I loved about her was how she would bend so that others wouldn't break. And that sentiment of how hard these mothers who are already at a disadvantage are working, but if we can do things knowing that they're going to have to bend, but that we can be there so they don't break, I think is something that Jen would also be proud of. Those mothers are working hard and making sacrifices. Everything we can do to help make it a little bit easier. Incremental changes are impactful and meaningful. And I think she would take a lot of joy in seeing that realized.
Beautiful. Thank you. And thank you for continuing to be committed to this cause, for being a community leader and an outspoken advocate for the moms, especially who don't have access to these basic necessities to secure a really healthy childhood and birth for their little ones. So thank you for all you do and for your time today to be with us. Is there anything else we didn't talk about you want to share, or anything else that you would like to highlight or reach out to our listeners with?
Yeah, no, I don't think so. If you feel compelled, volunteering, donating, awareness, all of that are, the standard sort of things, spread the word, keep an eye out next November for our events, but mostly just grateful for the opportunity to share Jen's story and our mission here as a foundation. If people are moved to help in some way, we love that, but it's great just to get the awareness out there as well. So really, really appreciate the platform and the time today.
Well, we're grateful for you. We're grateful for your team. And thank you again for all the ways that you are a positive leader and hero in our community. Thank you.
Thank you.